Hello, my name's Raven, and I'm here to tell you about the human immunodeficiency virus, commonly known as HIV, or in later stages, AIDS. HIV is a disease of the human immune system caused by an infection with the human immunodeficiency virus. This virus weakens the human immune system by destroying T cells that fight away disease and infection. With viruses like those that cause the common cold, over time your body wards off those viruses. This is not the case with HIV. Once infected, the human immune system cannot get rid of the human immunodeficiency virus, and scientists are still trying to understand why our immune systems can ward off other viruses but not HIV. Over time, HIV can destroy so many of our T cells that your body cannot fight infections and diseases any longer. When this happens, HIV infection can lead to AIDS. The acquired immunodeficiency syndrome is the final stage of HIV infection. People at this stage of HIV disease have badly damaged immune systems, which puts them at a risk for opportunistic infections. AIDS is not something you inherit from your parents. You acquire AIDS after birth from exposure to the human immunodeficiency virus. HIV is found in specific human body fluids. If any of these fluids enter your body, you can become infected with HIV. HIV is exchanged through bodily fluids in many ways, which include sexual contact from one partner to another, from mother to child during pregnancy, labor, or breastfeeding, from one person to another through injection drug use, from occupation exposure, and finally through blood transfusion with infected blood or an organ transplant with an infected organ. The fluids that transmit HIV include blood, semen, preseminal fluid, breast milk, vaginal fluids, and anal mucus. Other body fluids and waste products do not contain enough HIV to infect you. Within 2 to 4 weeks after exposure to HIV, many people, but not all, people who are infected experience flu-like symptoms. These symptoms include fever, swollen glands, sore throat, rash, fatigue, muscle joint aches, and headaches. Many HIV-positive people do not have symptoms. They simply do not look or feel sick at all. Some people only begin to feel sick when they progress towards AIDS. If you think you may have been exposed to HIV, regardless of whether you're feeling symptoms or not, you should get tested as soon as possible. You cannot rely on symptoms to know whether you have HIV. The only way to know for sure is if you get tested. As I have already stated, AIDS is the late stage of HIV infection. When a person's immune system is severely damaged and has difficulty fighting diseases and certain cancers, your infection has progressed to AIDS. Before the development of certain medications, people with HIV could progress to AIDS in just a few years. Currently, people can live much longer, even decades or a full lifespan, with the current medication. This is because of highly active combination of medications. Although there is no cure for HIV, there are medications that help combat and fight off the symptoms and the virus for a longer period of time. Scientists believe that humans came in contact with HIV in Western Africa, while hunting and eating infected chimpanzees. HIV may have jumped from monkeys to humans as far back as the 1800s. 33.4 million are currently living with HIV or AIDS. More than 25 million people have died from AIDS worldwide since the first cases were reported in 1981. In 2008, 2 million people died due to HIV or AIDS, and another 2.7 million were newly infected. In the United States, greater than 1 million people are living with HIV. 1 out of 6 of these people living with HIV are unaware of their infection. About 1 in 4 new HIV infections arise amongst the younger generation of teens and young adults. This is about ages 13 to 24. Gay and bisexual men of all races are the group most severely infected with HIV. And by race, African Americans are the group most infected with HIV. At a global outlook, A 2008 census reported that 2 million people were living with HIV in Latin America and 4.7 million people were living with HIV in Asia. 97% of the people living with HIV worldwide live in Africa in low-income countries. As of December of 2010, a cumulative total of 31,000 people have been diagnosed with HIV or AIDS in Louisiana. 316 of these cases were pediatric. There is no vaccine to prevent HIV infection and no cure for AIDS, but it is possible to protect yourself and others from infection. That means educating yourself about HIV and avoiding any behavior that allows HIV-infected fluids into or near your body. I hope that you have enjoyed this overview, and if you need further information, consult additional resources.